Yvonne Heredia is a doctor of public health and is a master's prepared registered nurse with 20 plus years of expertise in women's health, specifically birth outcomes. Dr. Heredia is also a subject matter expert on the topics of social determinants of health, health disparities, and population-based health. Dr. Heredia is currently a senior manager of care management at uh, Neighborhood Health Plan of RI, that's Rhode Island. She is passionate about working with the underserved or unserved populations. Dr. Heredia, you're welcome to Morbidity and Mortality Podcast.
Thank you.
So today, we're just gonna, rub minds together with regards to the issue of minority women's health and COVID-19. As you know full well, COVID-19 is the current talk of the town with regards to public health. So in your opinion, based on your specialization and expertise, what is the state of women's health and minority women in particular in this COVID-19 pandemic period?
So I would start off by saying, the state of women's health overall, as always, has always been a challenge. When you look at overall birth outcomes and you look at the morbidity and mortality amongst women, just as a woman, there's challenges. But when you add in the minority piece to it, there is an alarming, piece of not being, in a good state.
Right.
What I mean by that is that, as we go along, you'll hear me talk about the inequalities. You'll hear me talk about the health equity. So currently, right now, the state of women's health, in particular, women of color, we're not doing so well, for this pandemic. There was an article in the AARP that said, these are the factors. Being older and being Black in America is actually a deadly combination as it relates to COVID. Mm. So just that alone tells us that the state of women's health as a whole, we've definitely got some challenges.
Right, and totally talking about challenges. What challenges regards to health equity are women of color facing at this particular time?
Well, great question. There's many. So when you think about equity, I always like to paint a picture of what, because not everybody knows when we talk about equity, we talk about health equity, what does that mean? So I always, if you don't mind, I'd like to start with equality versus equity, just so I can paint a picture. And, it'd be nice if I had a blackboard I could write on. But so equality, as you know, means sameness. It means giving everyone the same thing. So that's equality. Everybody gets the same thing. But the challenge with equality, it also means that we all must start from the same place.
Right.
So in order to be equal, you all have to start at the same place. Equity means fairness. So that means access to the same opportunities. So I would always lend myself to say that you must ensure equity before you can even think about equality and before you can even enjoy equality. So the equity, back to your question, the challenges in health equity is that we are not all starting at the same place. So, we always, access to healthcare has done a better job. I'll say the healthcare system has done a little better job at having access to care in Rhode Island in particular. Pregnant women are able to access health insurance. Children are covered no matter If your parents work, you'll go under their health coverage. If you meet a certain poverty level in Rhode Island, you can apply for health insurance. The challenge that women of color face is that it's not so much access to care where the equality is. It's really about the status of care that we receive.
Right.
We don't receive the same type of care. An example of that is when someone goes in and they may have had a history of drug use and they're minority. They may not get the same level of treatment because they have a history and they're of color. So there's no equity in that.
Wow. This is a big challenge. And I like the distinction you drew between equality and equity. It is very, clear and concise and novel to me, so thank you for, making that demarcation clear, with
You're
regards
welcome.
to equity and equality. And you've brought up this challenge or some challenges that minority women face. Let's think about the solutions, since we have enumerated the challenges. What solutions or actions are necessary to reduce some of these imbalances or challenges that you mentioned that women of color are facing during this difficult time?
So I would say we have, for action steps and solutions, it's going to have to start with power. Okay. So power and policy. So, unless we can all meet at the same table and start talking about relinquishing some of this power that some of our counterparts have, in terms of, some people call them gatekeepers, some people call them policymakers. Not all policymakers are bad, right, as we know. However, I think that the policy has to change to really understand why are we not really making strides in minority health that we should have made 20, 30 years ago. Like, why are we still talking about poor birth outcomes for women of color when you can even put education, like I'm educated and I've had poor birth outcomes. So there's got to be something missing from the equation that some of us may not, have thought about. So I would first say power. Power means that you have to relinquish some of that power and give it back to the community. Let the community start telling us as healthcare providers what it is that they need to be able to move forward with their health. Let's not us assume all the time that it's bad behaviors. People are not caring about their health status. Minority people, as a minority woman, we care about our health care. Right. We care about, we don't want to be sick, but we also have to trust. So building trust. So action steps 2, I would say, for the healthcare community is to start building that trust with the community. Right. If you don't have that, you're never going to get to the core of what needs to be done. Right.
Building trust. When you say that, what came to mind was the Tuskegee Airmen experience.
Yes.
And yeah, that's what quickly came to mind. And another thing that came to my mind is what we're facing right now with COVID-19 vaccine, where they couldn't find people of color to volunteer, for the vaccine experimentation, so trust is huge, it's very important for policymakers and decision takers to begin to think about how best they can, start winning the trust of minority populations here in America. Dr. Heredia, I read an article in the Forbes magazine, and it says that in the entirety of the workforce, Black women are paid 62 cents for every dollar that a white man earns. So low-income workers, predominantly women. They constitute about 70% of the workers in jobs that pay less than $10 per hour. And Blacks and Latinas are overrepresented in these jobs, as you may well know. So lower income women are far more likely to lack sick leave and access to quality child care than wealthier women. So what difference does these statistics make in people's life during this pandemic?
Wow, it makes a huge difference because remember, money allows you to have access to other things such as technology.
Right.
Technology means information. I think about the homeless population. So you could be in the working class and still have nowhere to live at because the rents are too high. So that those statistics makes a huge difference in the lives of people, because if they don't have the dollars, they don't have the access to the technology that they need to be able to understand what's happening around them. A lot of updates are done on TV. A lot of updates may be done through texting. If someone doesn't have access to these technological devices, how are they going to be able to assume their health potential when they don't have the information? So those statistics are pivotal to the improved health outcomes in our community.
They are very pivotal to improve health outcome in Black populations in America.
Yes.
Yeah, I agree with you. And oh man, homelessness, I don't want us to get into that today. Maybe it's another topic we can take up in the future, because it makes no sense to me seeing people sleep outside under negative degrees in the United States of America, where you have skyscrapers and multi-million dollar buildings, dotting almost every street in the country. And people think that human life does not matter to them. It's astonishing, but that's my own bias, Dr. Heredia. Yeah. So I was reading Catherine Powell's article on CNN opinion page, and in that article, the statistics review they were mind blowing to me. So in this article, written in April of 2020, jobless claims was about 16 million people of color were hit so hard. Joblessness, 16 million people in America of Black color were affected. Then in March, unemployment rate for Blacks was highest at 6.7%. Does COVID-19 actually have color?
So that's it. I would say COVID certainly may not have a color.
Right.
But color does play a huge proponent in what the cases look like. So right. I want to bring your attention to minority communities, that are facing these alarming numbers of being COVID positive and dying. So COVID in itself may not have a color, but there's something that we have not yet put our fingers on as far as why. Like, we all have opinions and notions as to why, the cases are on the rise in minority communities. But I will tell you that, COVID probably doesn't have a color, but I can tell you that what's happening around us does have a color. We are, as a woman of color, we are facing the biggest challenges that I've ever seen. And when you think about the 60s, you think about Dr. King, you think about all these things, and you're like, we're still in we're in the 21st century, and we're still talking about equity. We're still talking about minority health not being equal to our counterparts.
Right.
So again, COVID certainly may not have a color, but there's some color that is distinguishing us between our counterparts.
Interesting. All right. So why are women of color vulnerable to COVID-19?
So I believe that there could be many things. There's been articles written about racism, about structural racism. There's been articles written that talk about behaviors that minority behaviors put themselves at risk, and that's not true. Because again, I go back to trust in the healthcare system. Tuskegee being one of them. So remember, Tuskegee wasn't even finished into the late, I want to say early 70s.
Right.
That is within our time frame.
Mm-hmm.
So that's not that long ago.
Mm-hmm. It's not long ago. Go ahead. Sorry.
Right. So it's not that long ago. So there is a lot of trust building that the healthcare systems needs to prioritize and start, adhering to.
Mm-hmm.
That's one. Second, I think that we have to start looking at, the vulnerability of women and their status, minority women in itself. So think about, the workplaces, think about the community places, think about all those places where women of color are vulnerable, never mind the healthcare piece of it. So we are vulnerable just being Black women, itself.
Right. That color, Black, kind of like pushes us out there as targets in my mind,
Yep.
So yeah. And that brings me to something called discrimination. I was discussing with Dr. Greg Ford, a dean of faculty of one of the universities here in the US, in Georgia, to be specific. Mm-hmm. And that was in my previous episode. So he mentioned discrimination as a variable that affects minority populations during this pandemic. What more can you tell us about discrimination in relation to African American women during this pandemic?
So I think that absolutely, I would be remiss if I wouldn't say that there's some discrimination that happens, because I can tell you that just in my own family, and I talk about discrimination, it may not be intentional, but discrimination is discrimination. So right. I would lend this conversation to say, absolutely, there's some level of discrimination that's happening during the pandemic. You think about some of the stories that you hear in New York City, California, Chicago, Maryland, all these cities where there's some population, there's a higher population of people of color. There's stories that say, I went in to try to get a test. I was told that I didn't have the right credentials. There's discrimination, as far as accessing resources. So right now there's survival mode of the fittest. So there is some level, but I am hoping that with venues like yours, and the more we speak about it, the more that we have, and not just speak. I think I would want to say that we've got to have more interventions. We've got to have solutions. So talking about it is great. It's, I call it lip service. We've got to start moving towards outcomes and interventions, and that's the way that the community is going to know that everybody is serious about keeping them healthy.
Right. And to me, I think what you just described is called assertive action. We'll have to take some pragmatic steps into actualizing what we are talking about. We just don't talk, we walk the talk.
Yes.
Yeah. So I appreciate that. So can you tell me something I don't know about single moms? How are they affected by this COVID-19?
Profoundly.
Wow.
So I'll
Wow.
tell you. So if a single mom is the breadwinner in the family, and this pandemic has left her with childcare challenges, so that's one. So if she has to work, and they're shutting down some childcare places, a single mom is at greater risk of being homeless or not being able to earn money. Education. So they've, in some areas, they've made school remote. So these if you are able to work, you have to now decide how you're going to split your time between your helping your children get educated and to work, if you have that. And then further on, if you have lost your job and you have no source of income as a single person, there's no two incomes, it's just yours. So you absolutely have a profound effect if you're a single mom during this time of pandemic.
Now, I've learned from you how single moms are dealing with this pandemic and the challenges they are faced with. Uh, I think, more steps should be taken by policymakers, especially lawmakers, to help, people like this, population like this, effectively well, to help them cope with the stress of this pandemic, dealing with, their kids, working, going to work, and, helping them with classwork and all that kind of a thing, So it's a lot of challenges I can see from what you have enumerated or stated during these few minutes we have talked, that, the minority population are facing in this country. So, Dr. Heredia, I want to thank you for coming to Morbidity and Mortality Podcast today. At this point in time, do you have any closing remarks, anything to tell our audience?
I would say that we need action. We need to have more policymakers step up. Sometimes you may be the policymaker that has to pave the pathway towards, improving the health of minority communities. I think that some people have great intentions, but, it's time for action. The community wants to see action. We need to address the structural inequalities that we have. That's one. We also need to make sure that we recognize that race is still a factor in the 21st century. It's alarming and it's mind-blowing, but it's real. Walk a day in a minority woman's shoes. Walk a day in a minority man's shoes. It's not easy. It's not easy. It's on our mind every time we wake up. And, so I feel like it's time for action steps. I think that we've been surveyed out. I think that we've collected enough data. I think now the community needs, and the community not only needs, but it's time for them to have action. It's time for us to stop collecting data and start giving the communities of color the equity that they deserve, the equality that they deserve.
It's time for equality and equity within the community of color
Yes.
here in America. Dr. Heredia Yvonne, thank you for coming to our podcast.
Absolutely, it was a pleasure, and I'm here, and I just think that this was an amazing topic that needed to be discussed. I hope that we have listeners that can support the action steps that are needed. And again, I thank you for inviting me.
Thank you so much.
Take care.
You too.